Welcome back! It's episode 3 of Therapies with your Professor Gerding. Hey, introductory psychology class, wubba-lubba-dub-dub. It's time to talk about humanistic therapies. Remember when we're talking about humanism? Think Carl Rogers and Abraham Maslow. So let's get into this. It's a nice touchy-feely section, so I'm excited about this. It's all about love. Humanistic therapies believe some core things. They believe that free will is one of the most important human motivations. This idea that we're free to make our choices, but most importantly, we are doing our best to be the best we can possibly be. So humanistic therapy really focuses on your ideas of yourself and your conscious thoughts, not this unconscious stuff that Sigmund Freud talked about, but your conscious thoughts, what you actually think of yourself. Carl Rogers came up with an amazing therapy known as client-centered therapy, also known as person-centered therapy. Why is this important? Because right away, it's not patient-centered therapy. He's calling his patients clients, and these clients, people. Client-centered therapy. Why? Why not call them patients? Well, this is a term used in the medical field. And have no doubts about it. There is a purpose in calling a patient because there's a power implication. I am your doctor and you are my patient. I spent years of my life dedicated to learning how to save your life. You listen to me because you're the lowly patient who needs to listen because your health depends on it. Respect my authority is basically what a doctor says to a patient. But when it comes to Carl Rogers, they're not patients. They're not these broken, injured things needing fixed. They're clients. They're people. They're human beings. Hence humanism. Oh yeah. Carl Rogers developed this technique. And remember, it's easy to remember Carl Rogers because he wanted everyone to be his neighbor, just like Mr. Rogers' television show. So let's talk more about client-centered therapy. And let me warn you, as I talk about this, it's going to sound so simple that it's stupid. You're going to think, anyone can do this thing. This is dumb. But as we talk about it, I think you're going to go through this journey, this process of slowly realizing, oh my, this is actually a really difficult therapy to implement. But why would you go from thinking it's simple to complicated or hard? Well, therapy is non-directive. Means that the therapist should never tell the client what to do. If a client comes in and says, I'm sad, ooh, what do you think I should do? A Rogerian therapist, a client-centered therapist would say, I don't know. What do you think you should do? If they come in and say, man, I had this dream. What do you think this dream is all about? A Rogerian therapist would say, I don't know. What do you think it's about? Sounds pretty simple, right? Sounds pretty easy. Sounds pretty dumb. But it's more complicated than that, as you're going to see. The therapy focuses on the client's subjective perception of their self and their environment. If they believe something is happening in their life, whether that's true or not, if they believe it, it's happening to them. It's the eye of the beholder, baby. So if you think something is one way and you believe it to the point where it's actually affecting you, guess what? It is just as real as if it was actually real. I'll explain that a little bit further later on. But the one thing Carl Rogers really wanted to emphasize is that his clients weren't sick, they weren't crazy, he never talked about their illness, and he never talked about curing them. It was a process. According to Carl Rogers, we're all just living, breathing, and most importantly, growing. Life is a process of continual change and development. So while you may be suffering in the moment, he wouldn't say that you're broken, he just would say, you're growing, you're learning. Right now, it may be difficult, but progress. So here's the therapeutic conditions, and this is why the non-directive therapy known as client-centered therapy by Carl Rogers gets pretty difficult. Because you have to be genuine to the individual. If they're pissing you off or they're disgusting you a little bit, you got to share that. You can't fake it. We're really good at detecting bullcrap. For instance, if someone comes up to you and says, hey, I love you, baby. I love you so much. You can usually tell if they're full of crap. We're really good at this from an early age. We can sniff out someone being disingenuous, someone who's being fake. Just be real, man. But you also have to give them unconditional positive regard, and this is the keystone of client-centered therapy. Meaning there are no conditions under which you will not give that person respect, understanding, maybe even love, right? That's unconditional. Imagine being able to say that to someone. There is nothing, and when I say nothing, I mean nothing that you can do that will stop me from respecting you. It's a really powerful thing, but it also seems really impossible. Even to our children, because with our children, if they're breaking the rules and we call them an idiot, or we yell at them and show angry affect, I don't like you right now. By definition, that's conditional positive regard. You're letting your child know, in this current state, right now, what you are doing, I don't approve. Because my positive regard for you is conditional and you're not meeting those conditions, kid. So is it possible to discipline your child and show them unconditional positive regard? The answer, according to Carl Rogers, is yeah. It's as simple as admitting your humanity. It's as simple as apologies. It's as simple as disclaimers. So let's imagine you're my kid and you drive the family car in through the living room wall, running over the family dog and my favorite television set. You stumble out of the car door. You're drunk off your ass. You've got a hypodermic needle stuck in your arm. You reek of man sweat and marijuana. And it's 4 a.m, well past your curfew. It's going to be hard for me to handle this without my emotional reaction. It's very tempting for me to say, oh my goodness, you idiot, what are you doing? But according to Carl Rogers, all I have to do is have the presence of mind to say, hey, are you okay? I want you to know I love you, right? You understand that as my kid, you can run over all of our family dogs. You can run over every TV. You can run over me. You can murder me purposely. And that won't make a difference. I'm still going to love you. You understand that, right? And I want to make sure you're okay. Are you okay? With that being said, here comes the pain. What the hell were you thinking? But if you slip up, it's as easy as apologies and explanation. It's known as induction, a fancy term that means talking to your kid. So if you screw up and you call them an idiot or maybe pathetic, it may not be too late. You can just talk to the child as soon as possible and say like, whoa, hey, back downstairs when you ran over the dog in television, I kind of said some shit. I really apologize about that, but you know what? I love you, and that's why it was so upsetting. And I'll try my best not to show you that conditional positive regard in the future, because I love you, and in the long run, all that really matters to me is that you are healthy, that you're living the best you can be, and I want you to know that, so sorry about that. So it's really difficult to give unconditional positive regard. But an amazing thing happens, according to Carl Rogers. If we're able to give that to someone, then they will grow and become stronger. The fear is if we give them unconditional positive regard and we tell them you can do anything you want and I'll still love you, that they'll do whatever they want. They'll do all sorts of drugs, have all sorts of sex, have all sorts of rock and roll lifestyling. But you know what? You can still have them have consequences. Hey, I love you. You just murdered someone. You're going to prison, but that doesn't mean I don't love you. My goodness, you have my support in this. Anyway, and the last thing is empathy. An empathetic understanding. Empathy is stronger than sympathy. Sympathy is feeling sorry for someone. Man, that sucks. That must suck for you. But empathy is feeling that experience with them. Saying, oh my goodness, this is awful. What are we going to do? Sharing the experience with them. This is where it gets really difficult. Keeping all three of these things in mind for client-centered therapy is incredibly difficult. Imagine you have a client who's a 16-year-old girl, just turned 16, and she's rich beyond belief. And she comes to you and she's really upset. She says, I'm so upset. What's your pain? Lay it on me, you say as a Carl Rogerian client-centered therapist. And your client says, my dad, all I wanted for my sweet 16th birthday was Justin Bieber live to perform for my birthday party. And I wanted very specifically a red Lamborghini Diablo 2009. He gave me Justin Bieber. And he gave me the Lamborghini Diablo, but it was in yellow. I said red, and he gave me yellow. Can you empathize with her? Can you feel that pain with her? Because most people would honestly say no, and that's fine. Be genuine. If you can't empathize, you have to be genuine. Say, can't really empathize here. But here's the problem. I think you can, because you're focusing on the details. What you're hearing is Justin Bieber, Lamborghini, money, rich. That's what you're hearing. But have you ever been in a situation where you've clearly told someone that you love exactly what you want from them, and you know for them it would be really easy for them to give to you, but it seems that they're purposely not giving it to you. They're purposely withholding what you simply asked for. If you switch the details around, all I wanted was a hug when he came home, and he didn't even give me a hug. He gave me a pat on the back. That wasn't a hug. I think you can empathize. So, can you do client-centered therapy? Can you keep all these in mind? Oh, shoot! That's the time, meaning we're just about over 10 minutes. So, let me ask you this, and you don't have to answer this, but imagine you are a therapist in a prison setting and you get a pedophile that comes into your office. Can you use client-centered therapy? Can you be genuine and still give them unconditional positive regard? And even probably harder yet, empathize with them? It's really uncomfortable to think about. But when we come back in the next episode of Introductory Psychology, we're going to talk about behavioral therapies. So tune on in then. I'm your professor, Professor Gerding. Bum, 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 bum,